Hi, I'm Angela, and I wanted to talk to you just a couple of minutes about me and what Pilates means to me and what benefits it's brought to my life and how much it has changed my life and how much it could change your life. And I genuinely from the bottom of my heart mean that, okay? So this isn't a big kind of sales spiel. This is a real honest truth about what it's done for me. So I'm quite an unusual case in that I was born with congenital hip disorder and had, I think I was like 4 when I properly learnt to walk after traction, plaster cast, reconstructive surgery, and then I had another stint of big surgery in my late 20s, and I've had in my 30s I had both hips replaced, the first with complications with 2 further surgeries, and I was left with big portions of my life being in huge amounts of chronic pain. And I only really started to learn how to manage that when I found this lovely little physio-led Pilates clinic near my work, and I started going hard at Pilates and learning about my body and learning what the pain was doing to my body and how I could counter that. So when my glutes had become weak because of the hip pain, how strengthening those would benefit me. But even more importantly, really, is when I started my Pilates training, it was shortly after I just had my first baby. My first baby, I had an epidural, I was told when to push, and I was left postnatally, well, with really quite bad postnatal depression, and I also quite severe urinary incontinence. I had quite a few colds, and I was literally not being able to control my pelvic floor. And I went to the GP and was told to do, given a sheet on pelvic floor exercises that did nothing. I didn't know what I was doing. I was engaging the really superficial pelvic floor muscles, and I wasn't getting any benefits from it. And I really thought that was it. That's what mums had to contend with. I saw these tenor lady ads on TV and thought, oh, clearly this is what people don't talk about as being a mum. But then I started all my postnatal studies and I became fascinated, and I did course up. You can see on the website I've done course after course after course, and this has been as much about me wanting to help other women as it is about helping myself. So after baby number 1, it turned out I'd actually suffered a prolapse, rectocele and cystocele, which is where the rectal wall and the wall with the bladder have both collapsed slightly, which wasn't helping my symptoms. And actually, as I've progressed my training and learned more about how to connect with my pelvic floor and abdominals functionally, so not just lying on a mat and doing the breathing exercises, really learning how to integrate this in how I lift, how I move, how I carry my children, how if I'm moving furniture around in the lounge, that I either say, no, I'm not doing that, or I do it and engage my muscles correctly, really integrating it into everyday life. And now I don't suffer any of those symptoms. I'm 6 months postnatal, and I can jump on that trampoline, I can sneeze, I can cough. And I recently went to a gynecologist, and he said, your prolapse is barely there, it's mild, and the only thing I can put that down to is my Pilates practice. I can't really explain it. And each birth, I don't want to sell, like, I know this isn't the case for everyone, but certainly for me, the more I've learned and the more I've kind of learned this connection with my pelvic floor, the more positive birth experience I've had. Unfortunately, I'm not allowed to keep trying to see if the pattern continued. I think we're done at 3, but certainly it's been hugely positive in my life. And I would go as far as to say, on the pain management front, it just changed my life. So hopefully some of this rings true for you. If you like what you hear, then my website is full of all my courses and how I can work with you. Thanks for your time.